Hello, I'm Dr. Martin Waller, an Associate Professor in the School of Health Sciences here at the University of Southampton. I'm also the Admissions Lead for Physiotherapy within the university. I'd like to introduce you to physiotherapy and what it's like to study here at the University of Southampton. So firstly, what is a physiotherapist? Well, a physiotherapist aims to restore function and movement in people that have been affected by an injury, an illness, or a disability. Physiotherapists adopt an holistic approach to the treatment where they integrate and involve the patient in the development of their treatment so that the patient can self-manage their condition and then hopefully then improve their function and their movement. They treat a broad range of different conditions that affect the bones, joints and soft tissues, including muscles and tendons. It involves treating conditions that affect the brain and the nervous system, such as stroke, multiple sclerosis, Parkinson's disease. They can treat conditions that affect the heart and circulation. And they also can treat conditions that involve lungs and the breathing, such as patients that have cystic fibrosis, for example. And they treat patients across a broad range of ages, from the young, as I mentioned, say, for example, cystic fibrosis patients, and treating very young people, all the way through to treating the elderly. So those that maybe have developed osteoarthritis in their joints, who have maybe undergone a joint replacement. And they work in a variety of different settings, from hospitals, including intensive care units, through to working on the wards and working with patients that are in an acute setting, all the way through to working in the community and visiting people's homes and developing treatments and managing people's conditions within their own homes. Ultimately, the physiotherapist aims to improve the quality of life of people through the restoration of their function and their movement. So, how do we train physiotherapists? Here at the University of Southampton, we use different techniques and different facilities in order to educate our students. We use standard lectures, where we provide the baseline information and foundations to a particular topic or area. We then use seminar sessions where you work collaboratively with your peers on case-based learning, where you might then discuss a particular issue, a particular patient, a particular case to develop your understanding as a group. We then use practical skills sessions. This is where you get hands-on with patients in order to develop the skills and the techniques you would then use in clinical practice. We utilize simulated ward and clinics. So we're very fortunate to have simulated environments that look just like a ward environment you would find in a hospital or in a clinic. This enables the students to be immersed in that clinical environment and really develop their understanding of what it's like to be working as a physiotherapist in a clinical environment. We utilize simulated patients. So we have computerized mannequins that then present with certain symptoms and certain conditions. And our students, they need to identify those symptoms and develop a treatment plan according to what's being presented in front of them. We have actors that can come in to the practical skill sessions and they portray the patients or their family members. This enables the students to develop what we call their soft skills, their communication, their empathy with the patient and their family members, so that they can really develop a treatment plan that's going to be holistic in an approach and really hopefully then be worthwhile and impactful for the patients themselves. We have state-of-the-art recording facilities within our practical skill sessions, which enables the students and our lecturers to review the sessions after the event, so that we can review what went well, what could be improved, so that next time you can then develop skills even further and then become a well-rounded clinician. Placements are a key component to the education of our students. This is where students go out into real-world clinical environments and will treat patients. Here at the University of Southampton, our students go out on placements located around the south of England. Students will experience all the different broad areas of physiotherapy in various different contexts, including acute, so working in hospitals, subacute, outpatients, and also working in the community as well. We also offer placements in terms of developing a portfolio, so developing leadership and management skills in clinical practice, but also in education and also research. Here at the University of Southampton, our placements are organised and situated throughout the programme. So we offer a placement in the first year. So at the end of the first year, our students will go out onto their first clinical placement, which enables them to really put their clinical skills that they're developing into practice quite early on in the programme. But prior to going out to placement, the students are given 2 weeks preparation so that they can be taught and be instructed of what the logistics are, what it's like going out onto placement. So when they do go onto that first placement, they're fully prepared and fully aware of what it's like to be working as a clinical practitioner. We then have 2 placements in our second year and then 2 placements in our third year, with that final placement being very close to graduating so that you are what we call hot hands. You're kind of ready to go into clinical practice because you've just finished an experience in that clinical environment. So how do you apply to study physiotherapy here at the University of Southampton? All applications are undertaken through the UCAS system. The entry requirements for physiotherapy here in Southampton is a minimum of AAB at A level or an equivalent. But one of the A levels needs to be a pure science, so it needs to be physics, chemistry or biology. Once you submitted your application, we then review your personal statement and review that for your understanding of physiotherapy as a profession. So we want to understand your motivation for becoming a physiotherapist. What is your understanding of what a physiotherapist actually does? What types of patients do they treat? How might they treat them? What kind of approaches do they use? What are some of the barriers and challenges a physiotherapist might face? What are the particular skills and attitude a physiotherapist has, and how have you demonstrated those particular skills and attitudes that are needed to become a good physiotherapist? Once you reviewed your personal statement, we then invite you for an interview where we'll then discuss your motivation and your knowledge of the profession even further to assess your suitability then for the programme. Once you graduate from the programme here at the University of Southampton, you'll be a fully qualified physiotherapist, enabling you to go out and practice as a physiotherapist across the wide range of different areas that they work in. Our programme fully meets the requirements to become a chartered physiotherapist and be registered on the Health and Care Professions Council. 100% of our graduates go on to employment or further study following completion of their degree. Now, the NHS is the largest employer of physiotherapists, and you can work across a broad range of different areas, so from the hospital all the way through to a community setting, working in various different conditions, working with musculoskeletal conditions through to neurological conditions and cardiorespiratory and cardiovascular conditions. Of course, there are other opportunities as well, working in social care, in private practice, or including the armed services as well. If you would like more information about physiotherapy here at the University of Southampton, do visit our website where we have more information about the entry requirements. We also have more information about the modules and the content of the programme and the structure of the programme. Thank you for listening, and we do look forward to welcoming you to Southampton.